And now to a CBS 4 News exclusive investigation into a cleaning system for N95 masks that ended up costing Florida taxpayers much more money than it was worth.
It was supposed to help solve the nationwide shortage of masks, but as CBS 4's Jim DeFeeti discovered, at least in Florida, the project fell flat.
This decontamination system allows you to clean things like N95 masks.
In early May, Governor Ron DeSantis heralded the arrival of two new pieces of equipment pushed by President Trump and given emergency approval by the FDA.
So it can decontaminate up to 80,000 masks per day. So you'll have hospital systems, they can send in 20, 30,000, whatever they have for masks. They can be decontaminated and then sent back a couple days later.
On Thursday, with little notice, the state shut down its two decontamination units located at Hard Rock Stadium.
It's just too expensive to continue to run it, which is why we've demobilized it.
In an interview with CBS 4 News, the state's emergency management director, Jared Moskowitz, said that in the 30 days the machines were operating, they decontaminated only 597 masks.
But I can tell you from my end, to clean 600 masks, I mean, you're talking, hundreds upon hundreds of dollars per mask, over $500 per mask.
According to figures provided by the state, it costs $589.44 to clean each of those masks. A brand new mask, even during the pandemic, costs less than $8 to buy.
I am just mortified that there is so much mismanagement.
Congresswoman Donna Shalala served 8 years as the head of Health and Human Services during the Clinton administration.
The president had tweeted and put enormous pressure on the government to get them out, and that no one had been watching the cost of the machines is another example of the absolute mismanagement of this COVID-19 crisis by the administration.
Shalala suspects the company that designed the system, defense contractor Battelle, saw an opportunity to participate in the billions of dollars being spent to fight COVID-19. NBC News reported the initial federal contract for the machines was $60 million, but now may end up costing taxpayers between $400 and $600 million.
Sloppiness is one thing. We've always overspent in the Defense Department. They're used to overspending on planes and ships and everything else. But this is overspending and putting people's lives at risk. That's a whole different ballgame and very dangerous.
Moskowitz said he had not received any complaints about the machines and doesn't know why they were given so few masks to clean.
I don't know why they didn't use it, Jim. Obviously, we were in a pandemic. This is a first experience for everybody.
There was just very little science on how safe is this technology.
Martha Baker represents healthcare workers at Jackson Health System.
Re-sterilization of masks was a little suspicious. Their first instinct was it was based on supply and demand, not based on science. Perhaps desperation.
Moskowitz defended the decision to bring the machines into the state.
But we wanted to make sure, hospitals had every tool in the toolbox, everything that was being offered to us by the federal government.
Moskowitz said he believes that Florida is the first state in the country to return the Battelle machines. I'm Jim DeFeeti, CBS 4 News.
Now, a short time before we went on the air, the state contacted us with revised numbers. The total number of masks cleaned was 3,592, still far short of the 2.4 million. That means it costs $98 to clean an infected mask when you can buy a new one for less than $2.